What if I told you that 20% of your daily habits are driving 80% of your recovery outcomes? Today we're talking about the 80-20 rule of physical therapy. Because here's what most people don't realize. The exercises matter. The manual therapy matters. The stretching matters. But the big drivers? You'll want to stick around to hear this. The 80-20 principle, also called the Pareto Principle, basically says that a small percentage of inputs create the majority of outcomes. In business, 20% of customers create 80% of revenue. In physical therapy? About 20% of your habits drive 80% of your pain trajectory. According to data published in The Lancet, low back pain is the leading cause of disability worldwide. But here's the kicker, in most cases, it's labeled nonspecific. Meaning, no major structural damage explains it. Multiple large studies show that imaging findings like disc bulges are extremely common in people without pain. In fact, a 2015 systematic review found that over 50% of asymptomatic 30-year-olds have disc degeneration on MRI. And that number increases with age. So if structure alone doesn't explain pain, what does? After years of treating patients, here's what consistently makes the biggest difference: sleep quality, fear of movement, daily activity levels, stress load, beliefs about pain. Notice what's not on that list? Foam rolling technique, perfect posture, and the exact angle of your pelvic tilt. Now, you might be thinking, okay, are you saying posture doesn't matter? Not entirely. I'm saying it's usually not the main driver. Let me give you an example. I had a patient, 38-year-old engineer. Super analytical. Had low back pain for 2 years. He had tried everything: massage therapy, chiropractic adjustments, core strengthening programs, and a $1,800 ergonomic chair. He knew every muscle in his lumbar spine. But he was sleeping 5 hours a night. Working 10-hour days. Terrified to bend forward. He told me, "I just don't want to make it worse." Here's what most people don't realize. When you're afraid to move, your nervous system amplifies threat signals. Pain isn't just irritation. It's a protective output from the brain. Research from painscience shows that fear avoidance behaviors are strongly associated with chronic disability. People who believe movement is dangerous tend to move less, decondition faster, and recover slower. So what did we do? We didn't overhaul his program. We targeted the 20%. Improved sleep consistency, graded exposure to bending, stress reduction strategies, education about pain science. Within 8 weeks, his pain decreased by over 60%, and he returned to lifting his kids without fear. Not because we found the magic exercise. Because we addressed the drivers. Pain is influenced by context. Your brain asks, "Am I safe?" If the answer is "I'm not sure," it turns the volume up. Studies show that people with high stress, depression, or low social support are more likely to develop persistent low back pain. According to studies on social determinants of health, factors like job strain, financial stress, and lack of support systems significantly influence recovery outcomes. So when someone says, "My MRI says I have degeneration, so I'm doomed," that belief alone can worsen outcomes. It's called catastrophizing, and it's one of the strongest predictors of chronic pain. Look, your spine is strong. But your nervous system is sensitive. And that sensitivity is shaped by sleep, stress, expectations, past experiences, and what your provider told you. If someone told you, your back is fragile, your brain stores that. And it changes how you move. Here's an analogy. Imagine trying to grow a plant. You buy the best fertilizer. You adjust the leaves daily. You rotate the pot. But you forget sunlight and water. That's what most rehab programs look like. People obsess over corrective exercises while sleeping 5 hours and living in chronic stress. Here's what the research consistently shows. Poor sleep increases pain sensitivity, chronic stress elevates cortisol, which influences inflammation and recovery, physical inactivity increases risk of persistent disability. The basics, the boring habits, drive outcomes. And here's the frustrating part as a clinician. People want complexity. They want the 17-step mobility flow. But recovery often comes down to 4 or 5 foundational behaviors. Now you might be thinking, okay, but what about serious injuries? Yes, acute injuries matter. Yes, red flags exist. Yes, some cases require imaging or medical intervention. But for the majority of nonspecific low back pain, the 80-20 principle applies. Another objection I hear. But I sit all day. That's why I hurt. Here's the thing. It's not sitting itself. It's the lack of variability. Movement variability, not perfect posture, is protective. Let's get practical. If you want to focus on the 20% that drives results, start here. 1. Sleep like it's part of rehab. Aim for 7 to 9 hours. Consistent sleep and wake times. Dark, cool room. No scrolling in bed. Poor sleep is associated with increased pain sensitivity the next day. That's not motivational fluff. That's physiology. 2. Move daily. Even if it's not perfect. Walking is wildly underrated. 20 to 30 minutes per day. It improves circulation, reduces stress, and maintains spinal tolerance to load. You don't need the perfect program to start. You need consistency. 3. Gradually face feared movements. If bending scares you, avoiding it reinforces the fear. Start small. Partial range. Light load. Show your nervous system that you're safe. This is graded exposure, and it's powerful. 4. Lower global stress load. This is the non-Instagram part of rehab. Breathing drills. Time outside. Boundaries at work. Saying no sometimes. Chronic stress keeps your nervous system on alert. An alert system amplifies pain. 5. Upgrade your beliefs. This might be the most important. Replace, "my spine is damaged," with, "my spine is adaptable and strong." Language matters. Let's think long term. If you improve sleep by 15%, activity by 20%, stress management by 10%, those small changes compound. Kind of like investing, you don't need a 300% effort week. You need 1% better daily habits over months. That's how 20% of behaviors drive 80% of results. Here's the takeaway. Low back pain is common. It's frustrating. It can feel random and unfair. But in most cases, it's not a life sentence. Focus less on finding the perfect stretch. Focus more on sleep, movement, stress, exposure, beliefs. That's the 20%. And when you dial those in, results follow. Maybe not overnight, but steadily. And steadily is how you win.
This is PT Pete. Catch you next time on It Is What Is.